Dr. Sarah Chen had been working in clinical psychology for 15 years when she first encountered the complex challenges surrounding the diagnosis and treatment of paraphilic disorders. As a specialist in sexual and gender identity disorders, she understood that these conditions represented some of the most misunderstood and stigmatized areas within mental health practice. Her latest case involved a 34-year-old professional who had sought help voluntarily, expressing distress about recurring thoughts and urges that were causing significant impairment in his personal and professional relationships. This consultation would require Dr. Chen to navigate the delicate balance between providing compassionate care while addressing the serious clinical and ethical considerations that paraphilic disorders present to mental health professionals. Paraphilic disorders represent a category of mental health conditions characterized by recurrent, intense sexually arousing fantasies, urges, or behaviors involving atypical objects, situations, or individuals that cause clinically significant distress or impairment in functioning. The diagnostic framework established in the DSM-5 makes an important distinction between paraphilias, which are considered atypical sexual interests, and paraphilic disorders, which require the additional criteria of personal distress or harm to others. This distinction acknowledges that not all atypical sexual interests constitute mental disorders, recognizing the importance of distinguishing between consensual adult behaviors and those that cause harm or distress. The clinical understanding of paraphilic disorders has evolved significantly over the past several decades, moving away from moral judgments toward evidence-based approaches that focus on distress, impairment, and potential harm. Mental health professionals now recognize that these conditions exist along a spectrum of severity and impact, with some individuals experiencing minimal interference in their daily lives while others face severe functional impairment. The current diagnostic criteria emphasize the importance of clinical significance, requiring that symptoms persist for at least 6 months and cause marked distress or impairment in social, occupational, or other important areas of functioning. Research into the etiology of paraphilic disorders suggests a complex interplay of biological, psychological, and social factors that contribute to their development. Neurobiological studies have identified differences in brain structure and function among individuals with certain paraphilic disorders, particularly in regions associated with impulse control and sexual behavior regulation. However, these findings remain preliminary, and researchers caution against oversimplifying what are likely multifactorial conditions influenced by developmental experiences, learning processes, and individual vulnerabilities. The assessment and diagnosis of paraphilic disorders requires specialized training and considerable clinical expertise, as these conditions often involve sensitive and potentially legally problematic behaviors. Mental health professionals must navigate complex ethical considerations while conducting thorough evaluations that may include detailed sexual histories, psychological testing, and careful assessment of risk factors. The diagnostic process must balance the need for accurate assessment with respect for patient confidentiality and the potential legal implications of disclosed information, particularly when behaviors may involve harm to others. Treatment approaches for paraphilic disorders have evolved to include various evidence-based interventions designed to reduce distressing symptoms and minimize risk of harmful behaviors. Cognitive behavioral therapy remains the primary psychological intervention, focusing on identifying triggers, developing coping strategies, and challenging distorted thinking patterns that may contribute to problematic behaviors. These therapeutic approaches often incorporate relapse prevention techniques borrowed from addiction treatment models, recognizing similarities in the compulsive nature of these conditions. Acceptance and commitment therapy has shown promise as an alternative psychological intervention, helping individuals develop psychological flexibility and acceptance of difficult thoughts and feelings while committing to value-based behaviors. This approach can be particularly valuable for individuals who experience shame and self-criticism related to their condition, as it emphasizes mindfulness and acceptance rather than suppression of unwanted thoughts or urges. Pharmacological interventions may be considered in certain cases, particularly when paraphilic disorders co-occur with other mental health conditions or when there is significant risk of harmful behavior. Selective serotonin reuptake inhibitors have shown efficacy in reducing compulsive sexual behaviors and associated distress, while anti-androgen medications may be considered in severe cases involving risk of harm to others. However, medication decisions must be made carefully, considering potential side effects and the individual's overall treatment goals. The therapeutic relationship in treating paraphilic disorders requires exceptional skill and sensitivity from mental health professionals. Clinicians must establish trust and rapport while maintaining appropriate boundaries and addressing potential countertransference reactions. Many individuals with paraphilic disorders have experienced significant shame, rejection, and misunderstanding, making the therapeutic alliance crucial for successful treatment outcomes. Therapists must balance empathy and acceptance with clear expectations regarding behavior and treatment compliance. Group therapy approaches have shown effectiveness for certain populations, providing opportunities for individuals to connect with others facing similar challenges while learning from shared experiences. However, group composition requires careful consideration to ensure safety and therapeutic benefit for all participants. Support groups and peer networks can play valuable roles in recovery and maintenance of treatment gains, though they must be carefully structured and professionally supervised. The impact of paraphilic disorders extends beyond the affected individual to include family members and significant others who may struggle to understand and cope with their loved one's condition. Family therapy and psychoeducation can be valuable components of comprehensive treatment, helping family members develop appropriate responses and support strategies while maintaining their own psychological well-being. Partners may require individual therapy to address trauma, trust issues, and relationship concerns that arise in the context of paraphilic disorders. Prevention efforts for paraphilic disorders remain limited due to incomplete understanding of their development and the sensitive nature of early intervention. However, researchers and clinicians emphasize the importance of early identification and intervention for individuals experiencing distressing sexual thoughts or urges, as early treatment may prevent progression to more severe symptoms or harmful behaviors. Educational initiatives for mental health professionals focus on reducing stigma and improving clinical competence in assessment and treatment of these complex conditions. The legal and ethical dimensions of paraphilic disorders present ongoing challenges for mental health professionals, particularly regarding mandatory reporting requirements and the balance between patient confidentiality and public safety. Clinicians must be thoroughly familiar with legal obligations while maintaining therapeutic relationships that encourage honest communication and treatment engagement. Professional consultation and supervision become particularly important when working with these populations to ensure appropriate clinical decision-making and ethical practice. Research continues to advance understanding of paraphilic disorders through neuroimaging studies, treatment outcome research, and investigations into risk and protective factors. However, significant gaps remain in knowledge about these conditions, highlighting the need for continued scientific inquiry and evidence-based practice development. The field continues to grapple with questions of classification, treatment effectiveness, and the distinction between mental disorder and criminal behavior, requiring ongoing dialogue between mental health professionals, legal experts, and policymakers to ensure appropriate and effective responses to these complex conditions.